If I am pre-diabetic or type 2 diabetic and I want to better manage my diabetes, I want to limit the amount of cholesterol I consume in my diet. And I also want to modify how much trans fatty acids I eat in my diet. The consumption of those two compounds can actually increase my risk of having elevated cholesterol as well as a heart event. So the more I eat foods like chips, cookies, baked goods, processed goods, or I cook with butter, margarine, or I eat the skin of chicken, egg yolks, high fat dairy products, high fat meats, organ meats, those all can elevate my triglycerides, my LDL, my bad cholesterol number. It can also increase the amount of trans fatty acids I have in my body. All of these, the consumption of these things continually can make my insulin more resistant and it can hinder me from what I'm trying to do, right? So I want to limit eating those type of products, and I want to eat things again that are what? Lower in calories, higher in fiber, higher in water content. I want to eat more vegetables. I want to eat healthy forms of protein. I want to eat fruit, right? So those are things I want to consume more of as I'm kind of pulling away from those things that are processed, those things that are stored for a long period of time. When I think about that, I think of like Twinkies, or I think about like chips. I think about, donuts. Those are the type of things I want to eat in moderation if I'm trying to limit the amount of trans fat in my body. I know that's hard because those are the things that we like to eat. We love ice cream, we love donuts. And I think it's okay to enjoy those things in moderation. But if I'm someone who I'm trying to prevent type 2 diabetes, I'm going to limit my intake of those things. That's not going to be a regular part of my consumption. And you don't have to start there, right? If you're used to having a baked good every night after dinner, maybe you can consider slowly decreasing the how often you have that baked good. So maybe instead of having a slice of pie every night, you can maybe try to have a slice of pie every other night, and then break it down into it's 2 nights. And then you can break it down to when it's only on the weekends. And you can go even further and only have it on special occasions. But you want to try to limit and slowly pull it out of your regular consumption so that it can just be a little bit easier. Remember, you preventing type 2 diabetes, you managing your heart health is worth it. It's worth it for your life and it's worth it for your livelihood. I know it's hard, but you can make those changes today.